is to prevent promotion of the recovery. Of course, because we are managing the condition at the point where the accident has happened. So in that way, we can promote the recovery of the client, early recovery of the client. कब तक एम्बुलेंस आएगा, कब तक हम हॉस्पिटल पहुंचेंगे, कब तक इमरजेंसी मैनेजमेंट दिया जाएगा. If we do the early management of the client who are injured, who are suffering from the injury or the any kind of cardiac arrest, so we can promote the early recovery of the client. So this is a basic important concept, component or need or the purpose why we giving the first aid, why it is very important. That is most important part to preserve our life. Second, we can prevent a person from the further harm or injury or any dangerous, and we can promote a recovery of a client. Okay. Now moving on to the next slide. Next slide. Samiksha, are you there? Next slide, please. Okay. Now next is the condition that often required first aid. So as I have listened the previous session also, so I think you are very well aware about the conditions. In condition may we need to give the first aid to the patient, like bone fracture or any fracture condition. In the case of burn, in the case of choking, where the respiration of the patient has been stopped, in the condition of heart attack, where CPR is needed, that is cardiopulmonary resuscitation, any wound or bleeding condition where we need to stop the bleeding of a client, joint dislocation or any kinds of bite, maybe snake bite है, या फिर nowadays it is very common that dog bite. So if we know how to manage the first aid, how to do the first aid management of the certain conditions, that is we can give first aid and we can cure a life of a person. Okay, so condition that is bone fracture, burn, choking, heart attacks, bone bleeding, joint and bites. Another condition, next slide please. Another condition that is a battlefield first aid. Battlefield, I think you all know the meaning of battlefield. Battlefield where gunshot, any burns in the major area, any fracture or accident occurs in the major area, and shrapnel or any sharp injury has happened to that is called as the battlefield first aid. So I've seen either in the traditional battlefield setting is an area subject to damage by the large scale weaponry or such as bomb blast. Okay, so like certain condition like major burn है कि फैक्ट्री में आग लग गई या फिर सड़क से कि बस का एक्सीडेंट हो गया या ट्रेन का एक्सीडेंट हो गया या फिर कहीं ब्लास्ट हो गया. In certain condition we need immediate management or the first aid management for the person saving the life. Okay, so many conditions are there like bone fracture, burns, choking, heart attack, bleedings we have seen, but this is the condition where we need a first aider, a person who give the first aid in a available of the conditions. Okay, so in major cases, in battlefield cases, we need to train about the how we can manage the situation and how we can give first aid to the person. Okay, now moving on to the next slide, that is first aid box, because my main topic is to first aid kit or the first aid box. So first aid box is a collection of supply or equipment for use in giving first aid. Okay, so there's a one bag or one box in that we need all emergency item which is used to give first aid to a person or client who are suffering from injury or any kind of accident. Okay, so जितने भी emergency instruments हैं, जितने भी medicines हैं, जितने भी emergency equipments हैं, that we can keep in a particular box that is called as the first aid box. Okay, now next slide. component of first aid box. Next slide, please. Does there someone have any idea what we can emergency things we can keep in a first aid box? Yes, you can message in chat box. Okay, so component of first aid box. First and most important part which is coming in the case of accident or the injury, that is ABC, airway, breathing and circulation. So like fracture condition is there or any other emergency bites conditions are there, but before looking that condition, we need to first check the airway, breathing and circulation of the client. The first component will be that is airway, breathing, and second is the trauma, injury or the wound care. Now after making the airway, breathing, circulation clear or the in a working condition, we can second focus on the trauma or any injury or any wound care or any bleeding that we need to stop that focus. Then instrument or the equipment, that is important part. Medication that we need to keep, emergency medication like painkillers है या paracetamol है या other anti-allergic drugs हैं या like drugs which is used for the cardiac arrest that we can keep. So medication is the part, then personal protective equipment, because to saving a life of person or the client is important, very important, but saving to us also from getting any kind of worsening condition or the any infection is also very important. So PPE kit also very important. Other useful item like sanitizer commonly we use. Yeah, we can keep any diary or any manual first aid manual to get updated with the kind of first aid. Okay. So these are the component, that is airway, breathing, circulation, trauma and injury, instrument equipment, medication, and personal protective equipment and other useful items. Okay. Now next we will move on to the first component, that is airway, breathing and circulation. Next slide, please. Okay. So here for maintaining airway, breathing and circulation, first aid treat ABC as a foundation for good treatment. As I have previously mentioned that airway, breathing and circulation, making a patient airway clear, maintaining a patient breathing and making a patient circulation in a working condition, that is the first and the most important part of giving the first aid. Because if patient will not have clear airway, if patient is not breathing properly, if patient have no proper circulation, then it will be life-threatening things for the patient. So for first and the most important component, that will be ABC. Okay. For this will contain a suitable infection barrier for performing artificial respiration as a part of cardiopulmonary resuscitation. So for making ABC clear, that is airway, breathing and circulation, we need to give CPR. And while giving the CPR, it is very important, as I have already mentioned, the PPE kit, that is saving to us also is very important. So pocket mask and the face shield is important before giving any kind of CPR to the client, क्योंकि हमको खुद भी इन्फेक्शन से प्रोटेक्ट करना है. ऐसा नहीं है कि पेशेंट की इंजरी हुई है या एक्सीडेंट हुआ तो ही पेशेंट को कार्डियक अरेस्ट हुआ है, मे बी शायद चोकिंग हुआ है या वॉमिटिंग किया है पेशेंट ने. So in that condition we need to protect us also. Okay. So airway, breathing and circulation, I think we should move on the previous. Okay. Instrument that we can keep for maintaining the ABC or for giving the CPR, that is cardiopulmonary resuscitation, that is we can keep the airway, that is maybe oropharyngeal airway or nasopharyngeal airway. Then we can keep the ambu bag, that is valve bag, valve mask, ambu bag. With the help of ambu bag, we can keep artificial respiration to the client. Then manual aspirator or the suction unit. Manual aspirator or the suction unit, if patient has any kind of vomiting or secretion in the oral cavity. So by the manual aspiration or the suction unit, we can aspirate the saliva or the vomited content from the patient oral cavity. With the instrument and the stethoscope is important for the making the airway breathing and circulation clear. Okay, so these are the certain important uh, instrument or the uh, item which is important for maintaining airway breathing and circulation, that is airway, ambu-bag, manual aspirator, BP instrument or the stethoscope. Okay. Now moving on to the next slide. Okay. Next component will be, first component was ABC, that is airway breathing and circulation. Second component is trauma, injury or wound care. Okay. So trauma, injury and wound care means यहाँ पर अगर पेशेंट को एक्सीडेंट हुआ है, इंजरी है या वुंड है पेशेंट को, तो मीन्स पेशेंट यहाँ पे ब्लीड कर रहा है, यानी कुछ ना कुछ फ्रैक्चर की कंडीशन है. ठीक है. सो इन केस ऑफ एनी इंजरी सच एज अगर ब्लीडिंग कर रहा है पेशेंट या फिर बोन फ्रैक्चर हुआ है पेशेंट का या बर्न की कोई कंडीशन आई है पेशेंट की, इन दैट कंडीशन फर्स्ट एड किट में हमारे पास मोस्ट इंपॉर्टेंटली ब्लीडिंग एंड फ्रैक्चर की कंडीशन में बैंडेज शुड बी अवेलेबल. ओके. सो बैंडेज वी नो अधेसिव बैंडेजेस होते हैं, क्रैप बैंडेजेस होते हैं या फिर अगर हमारे पास कॉटन बैंडेजेस होते हैं, सो वी कैन गिव प्रेशर टू अ पर्टिकुलर एरिया एंड ब्लीडिंग कैन बी स्टॉप. ओके. So most important for injury, trauma or the wound care, we need to have a bandage in our first aid kit or first aid box. We have adhesive tape or adhesive bandage, can include one shade for a particular body part such as knuckles. Then crab bandage if any minor injury has been happened या फिर कुछ मोच आई है या ऐसा कुछ sprain हुआ है, in that condition crab bandage can be used. Okay, so for trauma and injury cases we need to keep the bandage in a first aid kit or the first aid box. Next slide. Okay. Another item that is needed, that is sterile gauze pad. Okay, gauze pad we can keep in a wounded area or the bleeding area so that bleeding can be stopped. One instrument that one item that is molluskin which is used for the treatment of blister or to prevent the blister or any minor wound in the particular place. You can see in the picture, that is the pictures of the molluskin for the treatment of the blister. छोटे छोटे bandages होते हैं that we can keep above the blister area, so we can prevent further harm or further injury or further pain in a client condition. Okay. Then antiseptic solution, it is of course it is very important because injury हुई है, wound हुआ है, तो हम clean करने के लिए बहुत जरूरी है कि we should clean the wound with the antiseptic solution. Okay, so antiseptic solution is important to keep in a first aid kit. Okay, so here sterile gauze, molluskin or the antiseptic solution which is needed. Next slide please. Okay. Dressing item, all dressing items are needed for any wound or any trauma or any injury. We need to keep the dressing items so that in a first aid things we can do dressing and we can again prevent the patient from further injury. Sterile non-adherent tape, that is a kind of pack or a kind of pad is used which is non-stick, again which is keep about the wounded area or the injured area. So again, it can prevent the further chances of infection or the harm. If in case of eye injury, we can use the sterile eye pad keeping above the eye, so we can again further prevent the injury on the eye area or the high risk in the eye area. Okay, so dressing all dressing item we need, sterile non-adherent pads we need, and the sterile eye pad we need in a first aid kit. Next slide. Okay. Another item, that is butterfly closure strip. You can see in the diagram, that is but how the butterfly closure strip work. It again it will have to prevent bleeding, and again it will have to to again making any help to worsen the condition like tissue damage or anything. Okay, so butterfly closure strip can be used, normal saline can be used, so we can wash the wounded area of a person. Soap can be used, so we can, if it is open wounded area or wounded area, we can wash with the soap also. Antiseptic adhesive tape can use, cotton roll and cold pack can be used to stop the bleeding in a person. Okay, so for trauma, injury or wound care conditions, we can use a sterile gauze. Most importantly, we can use the bandages, all kind of bandages, cotton bandages हैं या फिर adhesive bandages हैं या crack bandages हैं, that we can use. Sterile gauze pad, antiseptic solution, alcohol swab can be used. Moleskin for treating the blister, all dressing item, sterile eye pad, sterile gauze pad, non-sterile adhesive pad, bandages, butterfly closure strip, saline, soap, antiseptic adhesive tape, cotton roll, or the cold pack can be used for in a first aid kit or first aid box for treating trauma, injury, or the wound care. Okay. Now moving on to the next slide. Now third component was the instrument or the equipment. Okay, first was the ABC, airway, breathing and circulation. Second was the that trauma, injury and the emergency, and third part will be instrument or the equipment. Okay, so for instrument and for instrument and equipment, like trauma shear for cutting clothing or the general use we can use. Okay, we can use scissor also, but सीजर इतना ज्यादा यूजफुल नहीं होता है जितना ज्यादा हम ट्रॉमा शेयर्स यूज कर सकते हैं अगर पेशेंट को हमें यूज करना है, या लाइक सपोज अगर पेशेंट को हार्ट अटैक की कंडीशन आई है या फ्रैक्चर की कंडीशन आई, तो इमीडिएटली वी कैन कट द क्लॉथिंग फॉर गिविंग फर्स्ट एड ऑफ द क्लाइंट. CPR mask is also very important because in first component we have seen ABC, making ABC clear or giving CPR is the first most component. Okay, so CPR mask, because nowadays previously we have learned about mouth to mouth respiration हमको देना है in first aid condition, but nowadays masks are available, so we can just keep this mask in the patient mouth area which is covering the nose or the mouth, and you can see it has the big tube. Okay, so it will prevent the chances of contamination, like patient is having any, we can prevent the first aider also कि कुछ भी infection से first aid को prevent किया जा सके, because it has the long tube. तो जो first aider है, he can easily give respiration to mouth to mouth respiration to the patient, and it will help to cover the nose as well as mouth of the person who need the first aid. Okay, so trauma shear, seizure we can use, CPR mask we can use, tweezer you can see in picture with all the shape. We have used the forceps, we can common language we use to say that for removing any kind of blister or other form of the things, we can use the tweezer. Okay, then lighter can be used for example in emergency condition, if sanitizer is not available or anything like other things is not available, lighter we can disinfect them or we can sanitize the instrument or the item for the again for the use of patient. Okay, so instrument and equipment we can use trauma shear, seizure, CPR mask, tweezer or the lighter. Next slide please. Okay, next will be that is irrigation syringe. Irrigation syringe, I think you all know about the irrigation syringe, which is commonly used for the cleaning of the wound. कि wound को हम अंदर अगर कुछ डस्ट है या कुछ फॉरेन बॉडी या स्मॉल पार्टिकल्स अगर wound में है, तो by using the irrigation syringe we can clean the wound from the dirt or the any small particles. Okay. So with the catheter tip for cleaning the wound with the sterile water, saline solution or weak iodine solution can use. The stream of liquid flush out particles of dirt and the debris. Okay, so we can use for washing or irrigating the wound. We can use the irrigation syringe with the we can use the normal saline or iodine solution we can use. कहीं कहीं पे H2O2 भी यूज करते हैं, दैट इज हाइड्रोजन पेरोक्साइड, लेकिन उतना अलाउ नहीं कर रहा है बाय द मेडिकल फैसिलिटीज बिकॉज उससे टिश्यू इंजरी के चांसेस बढ़ जाते हैं। तो कॉमन जो सलाइन यूज होता है दैट इज नॉर्मल सलाइन वी कैन यूज। डिजिटल वाटर अगर अवेलेबल है वो, या फिर आयोडीन सॉल्यूशन जो डायल्यूटेड फॉर्म में आते हैं वो यूज कर सकते हैं हम फॉर इरिगेशन ऑफ द वुंड और यानी इंजरी पार्ट। ओके, alcohol rub that is hand sanitizer or the antiseptic solution can be used. Thermometer we can keep to see any variation in the patient body temperature. We can keep thermometer. Okay, next slide please. Okay. Cotton swab, cotton wool for applying the antiseptic lotion, safety pin for pinning the bandages, like if crab bandages is there, if cotton bandages is there, we can use the safety pin for the tying of the bandages. And of course, torch with the battery is also very important. The torch है plus battery in a working condition, एक्सपायरी नहीं होना चाहिए या फिर प्रॉपर वर्किंग कंडीशन नहीं है, ऐसा नहीं होना चाहिए। तो टॉर्च विद द वर्किंग कंडीशन, टॉर्च का यूज अगेन अगर पेशेंट का अगर हमको नाइट डार्क प्लेसेस हैं या पेशेंट को अगेन कुछ एस्पिरेट किया है तो फॉर दैट, या पेशेंट को अगर हमें रेस्पिरेशन एयर भी क्लियर करना है फॉर दैट वी नीड टॉर्च। Okay, so again I'm revising the instrument and the equipment, like trauma shears we can use, seizures can be used, tweezer we can use, lighter for sanitizing the tweezer or other instrument, CPR mask, irrigation syringe, alcohol rub, thermometer, cotton swab, cotton wool, safety pins, torch with the battery that we can keep in a first aid box as an instrument or the equipment. Okay, clear to everyone? Now moving on to the next slide. Okay. So as we have seen, there are certain components. The first component we have seen that is airway, breathing and circulation. Second component we have seen trauma, injury and wound care. Third component we have seen equipment or the instrument. Now fourth component is the using of medication. Okay, so common medication, like most commonly we can use the paracetamol, also known as the acetaminophen, is one of the most common pain killing medication, or either tablet or the syrup, or the for temperature reduction also we are commonly using the paracetamol. Okay, so paracetamol first we, as a medication we can keep in a first aid box. Pain relief spray or the gel, because in sprain condition और any injury condition या dislocation की अगर condition है पेशेंट को, तो पेन मैनेज करने के लिए, पेन को रिलीफ करने के लिए लोकल एरिया अगर कोई इंजरी है पेशेंट को, वहां पे अगर पेन हो रहा है, so in sprain or any condition we can use the pain relief gel or the spray. Anti-inflammatory painkillers such as ibuprofen है, naproxen है, और other non-steroid anti-inflammatory drugs can be used as a part of treating sprain or the strain. ठीक है, so combination भी हम यूज कर सकते हैं, लाइक पैरासीटामोल है या एंटी-इंफ्लेमेटरी है या फिर पेन किलर्स है. If it is combination also we can use, for separate for paracetamol we can use for the fever है या pain relief spray gel है या फिर anti-inflammatory pain killers है, that we can keep in a first aid box. Okay, next slide. Okay, for symptomatic relief like combined for pain, fever या फिर नॉन इन्फ्लेमेटरी हम यूज कर रहे हैं ऐसा टैबलेट फॉर्म में या ड्रग फॉर्म में. अदर फॉर इन केस ऑफ इमरजेंसी कंडीशन दैट इज डायरिया, तो डायरिया के लिए वी आर कॉमनली कीपिंग द ओरल हाइड्रेशन जो है हम यूज करते हैं, ओरल सॉल्यूशन है. सो फॉर डायरिया common drug that is loperamide can be used to reduce the diarrhea or the loose motion in a patient, especially important in remote area where dehydration caused by diarrhea is a leading killer cause in the children. Okay, तो अगर जैसे now in urban areas भी तो कि हाँ डायरिया हुआ है या लूज मोशन हो रहा है तो हमको क्या मेडिसिन लेनी है, या people are aware about the social media और anything. बट जनरली अगर हम रूरल प्लेस की बात करें, रिमोट एरिया की बात करें, वहाँ पे अवेलेबिलिटी नहीं रहती. Okay, So ORS या antacids है या फिर antidiarrheal drugs है that we need to keep in a first aid box to reduce again further harm or injury, further complication in a patient with the diarrheal condition. Okay. Antihistamines can be also used in case of allergic conditions like that. Okay. 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 Next slide. For poison treatment, we can keep the emetic agents. Okay, emetic agents means uh, the agent which is help to induce the vomiting in a person. Okay, so in poison cases, we commonly use the emetic agents which help to induce the vomiting. But according to the manual or according to the medical advice, in current scenario, vomiting induced is prohibited. रीजन इज दैट जब हम वॉमिटिंग इंड्यूस करते हैं पेशेंट में तो अगेन इट कैन गिव इंजरी टू द म्यूकस एरिया ऑफ द जीआई ट्रैक्ट या ओरल कैविटी, तो अगेन एब्जॉर्प्शन के चांसेस जो पॉइजन के हैं बढ़ जाते हैं. ओके, सो एमेटिक कैन बी यूज, वॉमिटिंग वी कैन इंड्यूस इन अ पर्सन बट इट इज प्रोहिबिटेड बाय द फर्स्ट एड मैनुअल कि हमको इंड्यूस नहीं करना है. कॉमनली जो यूज होता है दैट इज एक्टिवेटेड चारकोल इज यूज्ड. चारकोल क्या करता है, जितना भी पॉइजनिंग कंटेंट है इसको एब्जॉर्ब कर लेता है. ओके, सो इट विल नॉट गिव एनी इंजरी टू द म्यूकस और लाइनिंग ऑफ द जीआई वॉल ऑफ अ पेशेंट. ओके, सो विद वॉमिटिंग अगर इमरजेंसी सिचुएशन है, वी नो इमरजेंसी सिचुएशन है, हैंडल करना बहुत डिफिकल्ट हो जाता है. तो अगर वॉमिटिंग में इंड्यूस करना है तो वी कैन इंड्यूस द वॉमिटिंग बट according to manual it is prohibited. Charcoal can be used for the in the case of poison cases. Okay, so in medication we have discussed about the painkillers. Painkillers may be paracetamol है या फिर pain relief spray है या anti inflammatory painkillers है that can be used. Anti diarrheal medicine can be used. In that we can use ORS है या फिर antacid है या anti diarrheal drugs we can use. And antihistamine can be used for poison cases. We can use the emetics or we can use topical medication. We can also use like antiseptic ointment है या disinfectant ointment है we can use. अगर burn हुआ है, local place में है, हाथ में है या फिर face में है तो immediately we can use a burn ointment, है ना. Okay, then next slide please. Okay. Providine ointment or the iodine ointment can be used as an antiseptic in the form of, can be used in a weak dilution of clean water to prepare an irrigation solution for cleaning of the wound. As we have in the instrument section we have done about the irrigation syringe. Okay, so I have explained about that we can use the providine solution in a diluted form for washing of the wound or for cleaning of the wound for the small particle or the germ. Okay, so same way on that solution we can use, the topical medication we can use, that is betadine कि हमको अगर wound को clean करना है या wound में apply करना है तो हम iodine वहाँ पर use कर सकते हैं. Okay, second ointment or liquid is the hydrogen peroxide. It's often included in the home first aid kit, but it is poor choice for disinfecting wound as it can cell or the delay the healing. As I have previously explained, same when I was explaining about the irrigation syringe, तो hydrogen पर, but again अगर रिकमेंडेशन की बात करें तो नहीं यूज करना है बिकॉज एक तो डिसइंफेक्टेंट नहीं है ये, ठीक है. सेकंड ये सेल्स को किल कर रहा है जिसकी वजह से हीलिंग जो है अफेक्ट होगी पेशेंट, ठीक है. सो बेस्ट चॉइस विल बी फॉर यूजिंग दी सॉल्यूशन दैट इज प्रोविडेन आयोडीन कि हम उसको डाइल्यूटेड फॉर्म में यूज कर लें और इरिगेशन में या अप्लाई करने के लिए वुंड में हम यूज कर लें. H2O2 hydrogen peroxide is not in a choice because we know the reason कि एक तो डिसइंफेक्टेंट है नहीं है, सेकंडली सेल को किल कर रहा है और आपकी हीलिंग को ये अफेक्ट. Okay, so in topical medication we have seen about the antiseptic solutions, antiseptic disinfectant, burn ointment है, providine or the H2O. Okay, so this is all about the medication part. Medication we have seen the tablet or the oral form, antidiarrheal, paracetamol, painkillers, For poison cases, we have seen the emetic condition or topical application, that is COVID है या antiseptic है, disinfectant ointment है, we can use for the treating the patient with the wound or any first aid emergency. Okay, next slide please. मेडिकेटेड एंटीसेप्टिक ऑइंटमेंट, जैसे हम बोल रहे हैं कि एंटीसेप्टिक यूज करना है या फिर एंटीबैक्टीरियल यूज करना है, तो इस कॉम्बिनेशन फॉर्म में आता है मेडिकेटेड एंटीसेप्टिक ऑइंटमेंट. Ointment typically contain one or two or all three of the following antibacterial ingredients. So those containing three are typically called as triple antibiotic ointment. Okay, so बहुत commonly use होता है triple antibiotic ointment, क्योंकि inflammatory conditions है, इंजरी हुई है, हमको immediately apply करना है. तो component which include that is neomycin, polymyxin, B-sulfate and the bacitracin gel. So it will help in healing also. It is antiseptic solution ointment also. तो commonly जो use हो रहा है triple combination form में, that is वो क्या है आपका neomycin, polymyxin, B-sulfate और the bacitracin gel जो combination form में. Okay, so this is all about the that is medication used in a first aid kit. Okay, next slide please. Now fourth component will be, again I am repeating, first component was the equipment, fourth component was the medicine, and fifth component will be personal protective equipment. Okay, so personal protective equipments, we know we all need goggle है, gown है, mask है, gloves है, ये सब हमारे किस में आते हैं? personal protective equipments. Okay, so the use of personal protective equipment or PPE kit will vary by kit depending on its use or anticipated risk of the infection. Okay, so generally we know, या आप सभी जानते होंगे कि पर्सनल प्रोटेक्टिव इक्विपमेंट हम क्यों यूज करते हैं? ताकि हम अपने आप को, हम खुद को प्रोटेक्ट कर सकें. ओके, तो फर्स्ट एडर आल्सो या फर्स्ट एड किट आल्सो यूजफुल कि हम वहां पे पर्सनल प्रोटेक्टिव इक्विपमेंट्स रखें. लाइक हमको अगर इमरजेंसी में मास्क यूज करना है, या हमको फेस शील्ड अगर यूज करनी है, या अगर हमको ब्लीडिंग कर रहा है पेशेंट और हमको इमीडिएटली ग्लव्स यूज करना है, तो फॉर फर्स्ट एडर पर्पस हमको सेल्फ की सेफ्टी के लिए वी नीड टू कीप दी पर्सनल प्रोटेक्टिव इक्विपमेंट. ओके, सो जो कॉमन जो यूज होता है, कॉमन इन्फेक्शन कंट्रोल पीपीई इंक्लूड होता है, दैट इज सबसे फर्स्ट पार्ट आ जाता है हमारा मास्क और दी ग्लव्स. ओके, सो ग्लव्स आई थिंक यू ऑल नो, आपके जो ग्लव्स होते हैं बहुत सारे फॉर्म्स में रहते हैं, डिस्पोजेबल रहते हैं, रीयूजेबल रहते हैं. नाउअडेज डिस्पोजेबल ज्यादा कॉमनली यूज किया जाता है कि आप एक बार यूज करो उसको आप डिस्कार्ड कर दीजिए. ठीक है, तो gloves is coming under the PPE kit in personal protective equipment. Next slide please. Okay, now goggle or the eye protection. Okay, अगर कुछ इंजरी हो रही है या ऐसा कुछ है कि हमारे भी आईज में कुछ इंफेक्शन एंटर हो सकता है बाय एनी कंडीशन, so we can use goggle or other eye protection. Surgical mask जो common preference होता है, I think COVID के बाद से we all are aware about the जो common mask होते हैं अलग होते हैं. N95 mask is different mask, the possibility of airborne infection transmission, sometimes placed on the patient instead of the caregiver. Okay, so ये mask both फर्स्ट एडर भी यूज कर सकता है, पेशेंट में भी हम यूज कर सकते हैं अगर इन्फेक्टिव कंडीशन हमको लग रही है. So we can use the N95 mask. We can use apron for protecting our clothing. अगर ऐसा लग रहा है कि ब्लीडिंग है या हमारे खुद की क्लॉथ अफेक्ट हो सकते हैं या खराब हो सकते हैं, तो कॉमन जो वैसे तो पर्सनल प्रोटेक्टिव इक्विपमेंट बहुत